students and residents for several years for the Georgetown Family Medicine Department when I'm actually in private practice in Columbia, Maryland. Dr. Karuni on the line. I went to the phone, but I knew instinctively that this rare call from a gastroenterologist would not be good news. I was right. Nina, a longtime patient of mine, had been transferred from our local hospital to the intensive care at the university. She's in liver failure, and there's not much we can do for her, he said. Frankly, I don't expect her to make it. Nina had come to my office 7 years earlier, referred by the emergency room. A pale 49-year-old woman of average height and weight, she was pleasant and courteous, answering my questions in the telltale gravelly voice of a heavy smoker. I have a lifelong history of depression, she said solemnly. I learned that she and her husband had a daughter, age 20, and twin sons, age 10, and that Nina worked as an account executive for a large utility company. Her mother and brother had both committed suicide, she confided, and her one surviving brother was an alcoholic and was in jail. She had been estranged from her father for most of her life, but she had recently started to communicate with him. She forgot to mention that she too had a problem with alcohol. Over the next few years, Nina's husband, Nick, and their children and their grandson became my patients. I welcomed the opportunity to practice family medicine with 3 generations of the family. Sometime later, Nick revealed that he was a drinker as well. He told me that Nina would go on binges and drink gallons of wine, and that she had been to rehab in the past, but with little success. Attempting to be proactive, I naively referred them to substance abuse counseling. They politely accepted my referral, but as veterans of such counseling, they never followed up. Nina and I saw each other fairly regularly over the years. Besides hypertension, which was controlled with medication, she sometimes had mishaps. Once she broke 2 ribs, supposedly from tripping over her new puppy, but overall she appeared to be doing well. One day, routine lab work revealed abnormal liver functions, obviously an effect of her drinking. At that visit, and in those that followed, we started to have serious conversations about her quitting. I referred Nina to see a gastroenterologist to have her liver evaluated and hoped that he would reinforce my warnings about drinking. Only months later did I discover that she never visited the gastroenterologist. Why didn't you go? I asked, puzzled. Why do I need to see another doctor besides you? She countered. Though I appreciated her loyalty, I wish she could trust me enough to overcome her suspicion of other doctors. Looking at her, I could tell that she was getting worse. She looked ill and fatigued, and when I reviewed her records, I saw that she had lost 16 pounds, and her lab results were alarming. Her blood sugar levels were rising. This meant that the years of drinking had obviously taken its toll on her pancreas, and she was becoming diabetic. She couldn't take most medications because of her liver functions. Again, I raised the issue of alcohol and smoking. These are going to cut your life short, I told her bluntly. I'm not ready to quit, but I've cut down to less than 1 glass a day, she assured me. For the moment, I had to be content with that. Her weight loss was such that she no longer required blood pressure medication. A month later, she came in beaming. Guess what? I have great news, she said excitedly. I haven't drunk in 1 week. I've quit alcohol. To say I was skeptical was an understatement, but I focused on the positive. She had finally seen the gastroenterologist. Unfortunately, she also complained of feeling pins and needles and getting dizzy, and her blood ammonia levels were climbing, all signs of liver failure. So the downside of that visit was that I had to revoke her driving privileges. We scheduled a visit for a month later. But before that visit, Nina woke up one Sunday morning with a belly that was distended and horribly painful. She was rushed to the emergency room where she was diagnosed with intestinal obstruction and admitted to the local hospital. I only learned of this when Dr. Karuni called. He told me that Nina needed surgery for the obstruction, but the doctors were not sure that she could survive the procedure. She's really weak, very malnourished, with no muscle mass, and she's in terminal liver failure with advanced cirrhosis. Then he added the kicker. She's not even a candidate for a liver transplant until she is not drunk for at least a year. Disappointed, I thanked him and I hung up. Shortly afterwards, Nina's daughter visited my office, sobbing. She said of Nina, "She looks gray, as if she's at death's door." As the week wore on, Nina's weight dropped to 84 pounds, and she went into a coma. Whenever I asked her family about her, the answer was always the same. "She's still in the hospital," they would say in sad, resigned tones. After 7 weeks, Nina was sent home, presumably to die. But to my amazement, a week later, there she was. A 90-pound, emaciated skeleton of a person wheeled into my office waiting room. She looked so alarming, in fact, that the other patients insisted that she go ahead of them. "Hi, doctor," she said feebly as we sat in the office. Her persistent grin morbidly resembled a skull that had no lips or skin to cover its teeth. "Can you believe I made it out of intensive care?" she asked proudly. Her eyes shone with confidence that I could not share. "Good job," I said, wanting to help but feeling less than optimistic. Thoughts raced through my head. In Nina's weakened condition, the available therapies probably would do nothing. The specialists, the hospital, and even her own family had all given up on her. And yet here she was in my office, expecting me to work some kind of magic. What could I possibly offer her? We did have life and hope. "Let's work with what we have," I said, and she agreed. I formulated a game plan, knowing that even if Nina made it into the liver transplant waiting list, she would be in no condition in 1 year to receive the liver. However, I discovered that beneath that incredibly frail exterior was a strong determination to live. Our relationship became the epitome of micromanagement. I saw her often. Some visits were just about reinforcement and focusing on our goals. I told her to give up alcohol, and she did not touch a drop. I gave her an herb for her liver and vitamins. She took them religiously. She was now a flat-out diabetic, so I had to put her on insulin, and she gave herself the shots and controlled her blood sugars. She would not see an endocrinologist. I gave her nutritional instructions, and she followed them to the letter. She even revisited the gastroenterologist and reported his remarks. "I never expected to see you again, but I still have nothing to offer you," he told her. "Maybe a liver if you hang on." We had some exciting moments. First, when she was finally able to walk by herself again. And then when she hit 100 pounds. "I can't believe I made it," she said. "I've dreamt of this," tearfully she said. Apparently, that was an emotional landmark for her. Over the next year, to my amazement, Nina progressed to the point where a liver transplant was no longer necessary. Even more remarkable, 3 years after her near-death experience, her blood tests show no evidence at all of liver disease. Today, Nina weighs 136 pounds and has normal liver enzymes. She drinks, in her own words, an enormous amount of Pepsi. She's not a perfect patient, and she still promises that she will stop smoking one day. She's gone back to work, and she's driving again. "April will be my 5-year anniversary," she recently told me gleefully, and then added, "I often wonder why I was the only one of a family of 5 to survive this condition. I needed to go through what I went through, and I'm surprised that I'm still here. But I don't have the demons in my head anymore, and for the first time in my life, I can sleep." As Nina's physician, I feel that her faith in me and in our relationship fueled the magic that she was looking for. She needed me to be the one doctor who specialized in her as an individual. Together, we beat overwhelming odds, as I'm sure many family physicians and their patients do every day. I truly believe Nina is living proof that having just one physician who cares for you and about you can literally mean the difference between life and death.